Hello everyone, my name is Dr. Adair Machar Achek, consultant physician and CEO of Meditest Clinic. Today we are going to talk about a very important topic, which is hepatitis. Simply, hepatitis is the inflammation of the liver. This condition could be self-limiting or can progress to fibrosis, which means a scarring of the liver, cirrhosis, or can lead to liver cancer. Viral hepatitis is the most common cause of hepatitis in the world, but there are other infections that can lead to hepatitis. Toxic substances like alcohol and certain medication can lead also to hepatitis, and autoimmune disease can also cause hepatitis. There are five main hepatitis viruses, namely hepatitis A, B, C, D, E, of greatest concern due to their burden of illness and death they cause and the potential for outbreaks and epidemic spread. Only hepatitis B and C lead to chronic disease in hundreds of millions of people, and together they are the most common cause of liver cirrhosis and cancer. An estimated of over 300 million people worldwide live with chronic hepatitis B and C. Most of them don't realize they have hepatitis. Only 10% of hepatitis B and 20% of hepatitis C have been diagnosed. According to World Hepatitis Alliance, there are 5 main barriers to being diagnosed: lack of public knowledge of the disease, hepatitis, lack of knowledge of viral hepatitis among health professionals, lack of easily accessible testing, stigma and discrimination, out-of-pocket cost to patients for testing. Although there is a cure for hepatitis C and a vaccine and treatment for hepatitis B, lack of awareness results in 1 million preventable deaths each year. What are the symptoms of hepatitis? Symptoms vary according to the type of the virus, as we mentioned earlier, and the status of the infected individuals. But there are warning signs that we should be alert of, like fatigue, discoloration of the eyes, which is called jaundice, dark urine, pale stool, abdominal pain, especially the upper quadrant area, nausea, vomiting, loss of weight, and fever. Treatment of hepatitis C, which is one of the chronic diseases. Hepatitis C is a blood-borne virus that damages the liver and can cause liver disease and liver cancer. It can be transmitted when a person's blood comes in contact with infected blood, either through sharing needles, syringes, or injecting equipment, unsterile tattooing, body piercing needles, traditional marks, as we do in South Sudan, sharing toothbrushes, razor blades, and nail files. You cannot get hepatitis C through casual contacts, such as hugging, kissing, or sharing a bathroom, sneezing, or coughing. There are medications called direct acting antiviral with 95 to 99% cure rate and fewer side effects. How to manage hepatitis B? Hepatitis B is a viral infection that causes liver inflammation and can lead to a scarring of liver, which is cirrhosis, and increased risk of liver cancer and liver failure. It is transmitted through blood and other body fluids such as semen and vaginal fluids. Hepatitis B can spread through unprotected sex with someone who is infected, sharing needles, syringes, and other sharp objects, exposure to infected blood and body fluids from open cuts or sores. Hepatitis B cannot be spread through saliva or casual contacts like kissing, hugging, or sharing food. There is no cure for hepatitis B, but a vaccine is available. Hepatitis can be treated with antiviral medications that can help fight the disease and slow its ability to damage the liver. WHO, which is World Health Organization, has estimated 4.5 million premature deaths and 2.1 million cases of cancer could be prevented in low and middle income countries by 2030 through vaccination, testing, medication, and education. How to prevent ourselves of getting hepatitis? Through vaccination, which is available for hepatitis A and hepatitis B only. Safe sexual practices. Avoid share needles and other sharp objects. Maintain good hygiene, like washing hands after using restrooms and before handling food. Awareness messages to our viewers. Educate yourself about hepatitis through the authentic channels or professionals, medical professionals or healthcare professionals. Spread the right information about the hepatitis. Avoid sharing myth and misinformation. Support organizations that are working in the advocacy of this hepatitis. Also, we need to participate in activities like the upcoming World Hepatitis Day, which is on the 28th July every year. Promote testing in reliable and authentic laboratories and other healthcare facilities available or near to you. Try to reduce the stigma and discrimination against those who are living with hepatitis. As I mentioned earlier, there is an upcoming World Hepatitis Day. It is observed annually on 28th July, aiming to raise the global awareness of hepatitis and encourage prevention, diagnosis, and treatment. This year, World Hepatitis Day, let's break the barriers holding us back from a hepatitis-free world. What are the goals for this World Hepatitis Day? That everyone has the knowledge and understanding they need to make informed choices about hepatitis testing, treatment, and vaccination. For the decision makers to become advocates, providing the resources needed to improve the lives of the affected communities. Also, to put an end to the stigma for people living with hepatitis, encouraging no one is left behind. Another one is that everyone sees that hepatitis elimination is not only possible but achievable if we all work together to make it happen. Every year, 1.3 million people lose their lives to hepatitis, and the death is rising. Hepatitis now is the world's deadliest virus after COVID-19. There are over 2 million new cases of hepatitis every year. Over 300 million people are living with hepatitis. Hepatitis is the leading cause of liver cancer. Nevertheless, we are left with 5 years old to meet the global goal of eliminating hepatitis by 2030. But let us reflect on our situation as of now. Are we moving backwards or forward, especially in our dear beloved South Sudan? It's a message of reflection. Let us reflect. I was with you, Dr. Adair Machar Achek, consultant physician at Meditest Clinic. Thank you very much for listening.